World Health Organization said that it suspects the virus may have spread on board through person-to-person transmission. Let's get more into this whole situation here. We can bring in Rimoin, professor of epidemiology. She's the chair in infectious diseases and public health at the UCLA Fielding School of Public Health. I think, first of all, just for our viewers, if you can kind of walk us through, what exactly is hantavirus, how dangerous is it, and what are the symptoms?
Well, thanks for having me. And hantavirus is actually a series or a family of viruses that tend to be spread from rodents, who are the reservoir. And we've seen hantavirus here in the United States associated with deaths and severe illness in the western part of the United States. But hantaviruses exist globally. It can be very severe. You can have very high infection rates that result in death or very severe illness. And it can mimic flu or respiratory, common respiratory diseases or gastrointestinal diseases. So it can be very, very hard to know that you have hantavirus until you're very far into the disease.
The WHO there is saying that this outbreak likely involves human-to-human transition. If that is the case, how significant would that be?
Well, most hantaviruses are not very easily transmitted from person to person. And there is one hantavirus, the Andes virus, which is notably found in Argentina, where this ship has come through and where some of the passengers were traveling prior to this. There's the Andes virus that originates in Argentina. And that particular hantavirus has been associated with human-to-human transmission. Now, there's limited data. These cases are not very common, but it has been, but person-to-person transmission has been documented. But just because there's person-to-person transmission documented does not mean that this is very easily transmittable.
We see this live picture there of that ship docked off the coast, and we know that it will be making its way towards land. Do we know how much danger all of this poses to the public at this point?
The danger to the public is very low. This is a very serious situation, and certainly for the people who have gotten sick, for the people that are on the ship, this is a very serious and certainly very stressful situation for all of them. But this virus is very rare. It is generally not associated with human-to-human transmission. And the cases, we really do need to understand a lot more about these cases, exactly how they got it, which virus this actually is, which hantavirus it actually is, and then what the actual transmission patterns actually are before we really get ahead of ourselves here. I don't think that this is something that we're thinking about as a general risk. I think the risk for the public is low. I think that people who are considering taking cruises should not be concerned that this be something that should happen on a cruise in general. So I think this is a very specific and unusual situation.
Dr. Rimoin there from the UCLA Fielding School of Public Health, thank you very much for walking us through that.